Hello, I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Dr. O, Faithfully Transforming Healthcare. Today, we're going to discuss CHS's primary care service line. We'll also visit our integrated care practice in West Babylon, which meets a range of patients' healthcare needs, providing convenient access in one setting. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health, providing you access to the care you need. To speak about CHS's primary care services, we'll meet with the system's Vice President of Primary Care Services, Dr. Anthony Ardito, and visit one of CHS's integrated care practices. Dr. Ardito, thank you so much for joining us today at the Integrated Care Center here at Montauk Highway in West Babylon. Maybe you could share a little bit with our viewers at home your role at CHS, and also talk a little bit about primary care and the primary care service line which you're leading up, and about the goals and all the ambitions we have for growing out that service line under your leadership.
My current title, I'm Vice President of Primary Care Service Line, and our intent is really to grow primary care for the health system. We've been doing that pretty aggressively over the last year, hiring a lot of new graduates, and our real intent is focused around our patient care.
Right.
How we want to take care of them, first line access to them, and we really want to give them a sense that anytime they visit a primary care office in Catholic Health, they're getting concierge medicine.
Right.
They're being taken care of like they cannot be taken care of anywhere else on Long Island.
Maybe share a little bit about some of the goals. You mentioned recruitment. How have we grown? I mean, we've hired additional doctors. We've set up new wonderful practices like this one to provide greater access to care. Maybe you could share a little bit more detail.
I mean, we have grown at least 15 primary care physicians over the last year. We do have amazing graduates coming out of our Good STAM program. Yeah. They are functioning well in seeding new practices as well as joining established practices. So our intent over the next year is really to cultivate these new graduates, get them to the point where we want them to be, and offer the care that the patients in Catholic Health are accustomed to.
Wonderful. Now, you mentioned things like concierge service. What other services within your service line are you looking to implement to really create that whole comprehensive model for enhanced patient care?
Well, primary care goes beyond just seeing a patient in the office. Endocrinology has been a huge initiative for us. We want to grow endocrinology in both Nassau and Suffolk County, including obesity management and management of the entire population of diabetes, including the prevention of all the complications associated with diabetes.
Right.
I think primary care doctors do a good job in managing that, but we need to provide them with the services.
Maybe talk a little bit about what we're building in terms of brick and mortar hub centers versus smaller centers, and how we're placing them around Long Island.
I mean, you're currently in a new hub of Catholic Health. We've been open here about 4 months. The intent is really to offer patients the one-stop shop that they can get all their care located. So having a location where you have several 5 to 7 primary care physicians, cardiology, gastroenterology, all the things that the patients need to complete their care. And our goal is to develop these key locations around Long Island so patients have access to that care.
If you don't have a primary care provider, why do you need one? I think it's vitally important that folks maintain and develop early relationships with primary care providers such as yourself, because you really are the quarterbacks, right, that provide comprehensive care. Share a little bit on your thoughts on that.
I mean, you use the term that I would use. They really are the quarterbacks to a patient's care. They're the ones that the patient should be relying on to coordinate all the care that comes from all the medical subspecialists, the surgical subspecialists. So they're the ones that, meet with the patients once or twice a year, talk about their health goals, what they want to see accomplished over the next year. They also are involved in preventative. So before you get out to the specialist, you want a primary care doctor to catch those issues before they become long-term problems. So a primary care not only coordinates the services, they identify disease states before they become a problem.
Well, that's great. And so here we are in a beautiful new state-of-the-art location, but especially as you can see now with our masks on, we're in the middle of COVID-19, we had to innovate. We had to think about how can we provide different platforms of care for people. And so telemedicine, right, became very, very important. Under your leadership and the medical group's leadership, we expanded those capabilities. Maybe talk a little bit about what is telemedicine, and I think even later on you're going to give us a demo of this type of interaction, but for the viewers at home, what is a telemedicine visit, or as we like to call it, CHSE visit? Maybe you could talk a little bit about that first.
Well, telemedicine has been around for a while. The usefulness of it has not really come to light until the COVID pandemic. And that allowed patients to have continued access to our primary care physicians where they would not have normally come in to see us.
Right.
So it allows them to have a face-to-face conversation through the telehealth CHS e-visit site that allows the physician to actually look at the patient and see what's going on. It really enhanced our ability to take care of patients over the last 3 months. Moving forward, it's going to be an important part to transition of care, managing patients in different locations, and having access, 24 access to patients at their home.
Right.
So it may be involved in palliative care programs, transition of care, when patients cannot necessarily come into the office. And I do think that patients should be using a telehealth service instead of going to an urgent care center to talk to their primary care doctors to get the care that they need.
That's great. And so again, right from the comfort of their own home, they could log in and see a provider electronically from the safety of their own home.
Correct.
Really amazing. And so maybe you could give us a demo of this.
Jonathan, thanks for seeing me today through CHS e-visit. How you feeling?
Not so great, Dr. Arquito.
So I can tell based on the chart that you're 53, you have diabetes, high blood pressure, you have no allergies, you're currently on metformin and losartan. Tell me what you've been feeling.
Well, it started yesterday. I had a little cough, a little congestion, and I woke up today with a little fever.
Any shortness of breath, rash, diarrhea, anything else going on?
No shortness of breath, no rash. I noticed this morning when I was having breakfast that I couldn't really smell it.
Really? Tell me, what do you do for a living?
I'm an administrator for a computer company.
Really? Have you traveled at all? Where have you been lately?
I usually don't, but last week I went to Florida.
Really? Was anybody down there that you know that's been sick?
No, everybody that I saw was wearing a mask and socially distanced.
What about at home? Anyone at home's been sick?
No one at home.
All right. One of the things I'm concerned about is that, given the fact of your recent travel history and your medical conditions, I do think I need to see you in the office today. There are too many things going on that are suggestive that you might have some early signs of COVID, and I would like to get you and have you tested as soon as possible. Are you able to come in?
Sure, I appreciate it. I'd like to get tested.
Because I'll have my office manager call you in a few minutes. We'll get you scheduled and have you want to see one of our physicians live. But this is an opportunity for us to talk to you and see that you do need to come in. If this was something simple, I would probably just give you an antibiotic over the telehealth and say, call me if you don't feel better. But I'm a little bit too concerned right now, so please come in today.
So, again, creates a platform for you to be able to connect in, and in a way, triage remotely, right?
I think telemedicine is here to stay. We're going to be incorporating this throughout primary care through the CHS network. And our goal is to really allow patients and physicians to speak to each other in a way that manages their care in a better. So before they go to the ER, before they go to an urgent care center, they'll be speaking to us directly, and we can determine based on what we see, do they need more additional care, or can we see them in office, or even take care of them over telemedicine visit? So it is a way for us to manage our patients on a much different level than we have in the past.
Well, again, I want to thank you for everything that you've done for us, but for more importantly, all the things that you are doing, because I know, you're not just an incredible clinician, you're a great leader, and you're very passionate about providing the right care at the right place, the right time for everyone that you see. So thank you so much, Dr. Ardito.
Thank you, Dr. O.
We need to take a break, but when we return, we'll talk about the primary care service line. We will be speaking with Dr. Michael Rayo, a family physician in CHS's medical group.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to CHS Presents Dr. O, Faithfully Transforming Healthcare. We are joined by Dr. Michael Rayo, a family medicine physician in CHS's medical group. This is a beautiful new location. We're here at 501A Montauk Highway.
To start, it's basically split into two sections. There's one section here, as you can see, very large. The other side, we have cardiology, endocrine, and hopefully some more specialties to come.
So I think that's really important for the viewers at home. So, when you think about it, it could be one-stop shop. You could come in, you can be seeing them as primary care, but then you have specialties literally across the hall for them where they can get in to be seen by a specialist for more specified care, whether it be cardiology or whatnot, correct?
Absolutely, and patients absolutely love that. They love the fact that we walk across the hallway. I can show Dr. Kamesis an EKG. I can get advice right then and there. They've even come over to me to ask me, hey, this patient has a rash. Can you just pop in the room and take a look?
So it really brings the care, full circle.
100%.
Yeah, which is great. And how about the patients? Do patients like that?
Oh, they love it. This is our nursing station. We
Yes.
have where our nurses and MAs sit. Again, patients love it because they're familiar with the people.
Right.
Everyone buys into the whole concept of family practice.
Right.
And they really like this open space concept.
Got it.
Yeah.
And I mean, a plethora of exam rooms here.
Oh, yeah.
You're not going to run out of capacity.
Right.
Which is important, right? Because the second thing we're discussing today, folks are looking at us, we're in masks.
Right.
We're still working through COVID-19.
Absolutely.
So how has COVID-19 changed the way you practice, and how has the center here really made it, I think, more available to patients, certainly safer? You have plenty of space, and I've witnessed all of the safe practices about even checking into the practice
Right.
to make sure people are safe. But maybe you could talk a little bit about that.
So besides the obviously physical things, having the multiple rooms, we're able to keep everything clean.
Right.
We actually have rooms that are specific for anyone who might have any kind of symptoms that we're concerned about.
So it really is a beautiful state-of-the-art exam room. You have everything you need here, and I could see with the number of rooms you have, you could easily accomplish what you just laid out.
100%.
Yeah, so really
100%.
keeping people spread out, keeping people safe, dealing with their chief complaints, whether it be COVID or non-COVID.
Correct.
Right.
Correct. The other addition here is that when COVID occurred, telehealth was immediately instituted, and,
Right.
and we use that very well here.
Which is great. Which
Patients
means
love it.
People could check in remotely with
Right.
you as your physician to talk to them about their problem, what's going on, and then triage them, and actually even treat them. You could phone in prescriptions, do whatever you needed to
Yes.
do.
Very helpful with the elderly, especially during the lockdown.
Right.
A lot of them weren't even seeing their family in person. So when they saw us on the screen, it was like they were at Disney World.
So, and it's been amazing. This is a really important question because so many people, I get calls all the time, Dr. O, I'm afraid. Should I go in to see my doctor? I don't know what I mean, it's safe for you to come and see your doctor and get care,
Yes.
correct?
Yes.
Would you advise people come and get
We
seen?
reassure people all the time. There's still some people who don't want to come in, and there's some people who we say, you know what, it's better if you don't come in. We'll do it through telehealth.
Right.
But I just saw in the waiting room, we have chairs that are cordoned off. We make sure people aren't next to each other. They're all social distancing.
So, Dr. Rayo, now we're in the
Stress test room. Dr. Kamesis does exercise stress testing, nuclear stress testing, echocardiography. And
So again, just like you were saying, someone from down the hall seeing you for primary care, refer over Dr. Kamesis for cardiology, here you go. You got everything you need.
It's a great addition. I've had patients who have come in with chest pain and I need them seen by a cardiologist immediately. They're seen within 3 minutes.
That's wonderful.
You know, I walk them over and they're here.
That's wonderful.
And it goes for endocrine as well.
So endocrine as well.
Absolutely.
Right. Well, it's the way to provide comprehensive integrated care, hence why we named the center the Integrated Care Center. So,
Absolutely.
Wonderful.
Absolutely.
Thank you so much. We'll also speak with Dr. Santo Fiamano, a family medicine physician in CHS's medical group. Dr. Fiamano, thank you so much for joining us today on the show. And maybe you could share a little bit with our viewers about the difference between, how this has all changed in your practice of family medicine, moving from more of a mom and pop model, if you will, to more of a system-based integrated model here in this setting.
It's like comparing a single-celled organism to a multiple-celled organism. There's a degree of specialization and organization that makes it a lot more efficient and more productive. And, I was part of the old mom and pop system, and we've transitioned to this more system-based approach, and it's much better.
Do the patients like it? Do they find it more convenient? And do you think it provides better care for them?
I think the patients were more used to the old model, but when we start sending them to the other physicians that are in our organization and they see how the information flows from one doctor to the other so easily, and it makes their care easier for them, then I think they start to appreciate it.
That's wonderful. And so here we are, still in the throes of COVID-19, working our way through. And by the way, thank you and your team so much for the great care that you've provided to our patients. How have you think that this model, our new system-based model, and the way the whole medical group integrates, works together, how do you think that's impacted care during a time like COVID?
I think it really pointed out the strengths of the organization, and it allowed us to take care of people with COVID-related issues and also continue to safely take care of patients for their everyday medical issues. And I think the patients felt comfortable coming here to see us, and that during the whole COVID crisis, that was a real obstacle to delivering health care to people. They were so concerned about going into a healthcare facility, and I think they felt comfortable here with us. And that was great. It was really very gratifying.
Well, that's wonderful. I mean, I can't thank you enough for the wonderful care that you've provided to our patients, and I wish you continued success in your practice here at the new center.
You know what? You're helping me do that, and it's a privilege to do that.
Thank you, Dr. Fiamano. We have to take another break, but when we come back, we'll speak to Dr. George Vavilis, an endocrinologist in CHS's medical group, regarding endocrinology services.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay. Just go to the site.
Welcome back to CHS Presents Dr. O, Faithfully Transforming Healthcare. We are here with Dr. George Vavilis, an endocrinologist in CHS's medical group.
Thank you for having me.
Oh, it's wonderful. And we're very fortunate to have you as part of the integrated care delivery system here. Your specialty is endocrinology. Maybe you could share a little bit with the viewers who may not know, believe it or not, what it is you do.
So I'm a endocrinologist here at Catholic Health Services and at Good Sam Hospital. And, my job is to see uncontrolled diabetics, and at the same time, I manage other disorders in the endocrine system, such as the thyroid, the parathyroid, hypogonadism, people that have osteoporosis, or any other medical conditions that, we can't explain and try to figure it out.
Wonderful.
Yeah.
So maybe share with the viewers a little bit, what's new in your specialty of endocrinology?
Endocrinology is a fascinating field in medicine, and the reason for that is because we deal with a lot of complex medical cases. At the same time, the advancement in technology is actually outstanding now because there are new drugs on the market for diabetes, such as the GLP-1 agonists, which have shown to promote weight loss, control the glycemic control, and also to reduce cardiovascular risk. Now, in diabetes, especially the technology in CGM, which is a continuous glucose monitor, has helped type 1 and type 2 to control their blood sugars a lot better than before.
This is really amazing because I have friends, colleagues, and you'll see them out on the beach or in the backyard by the pool, and they're wearing their CGM, and they're monitoring their glucose, and that's really important, right? So when we talk about diabetes and diabetics, maybe share a little bit with the viewers. Why is it important to make sure you have what's called tight glycemic control? You're managing your glucose levels very well.
You need to have tight glycemic control because studies have shown in the past that patients that have an A1C less than 7%, it reduces the risk of heart disease, it reduces the risk of having stroke, kidney disease, diabetic neuropathy, diabetic retinopathy, which is a leading cause of blindness in the United States now, and also reduces your risk of going to the hospital.
Absolutely, and I think this is really important. And here we are working our way through COVID-19, and poorly controlled diabetics are at increased risk of complications from COVID.
That's correct.
Correct?
Yes. And that's the thing. In the last 3-4 months, covering Good Sam Hospital, you know, I've seen the patients that came in with COVID had hemoglobin A1Cs over 9%, and they're the ones that had the higher risk and comorbidities that, you know, with the actual disease.
And again, for our viewers at home, a normal A1C, which is a measure of how well your sugars are under control. So the higher the number, the poorer control, right? Under 5?
I would say you want your hemoglobin A1C to be less than 7.
Less than 7?
Yes.
Okay.
That's the target for us. The lower the number, the better. But as I said, for us, we want it in a certain range so you don't have either a low blood sugar or a high blood sugar.
Well, that's great. And I can't thank you enough for the incredible care you provide for our patients every day.
Thank you for having me.
Thank you to Doctors Ardito, Rayo, Vavilis, Fiamano, who spoke with us today about primary care services. Now for my final thoughts on today's discussion. Bringing care together around a primary care hub is so important. It is vital that you seek appropriate primary care. That's what's going to keep you healthy. Don't wait for you to get symptoms and get sick or have other diseases take hold. See your primary care doctor and schedule an appointment. If you don't have one, now's the time to get one. You could find a provider right on our website at Catholic Health Services. Now for advice on how to triage your life. My health tip and solution for today focuses on boosting your immune system. My goal is to bring you information that will help you live a healthier life. You know, with so many experts, it's hard to determine what's factual and what's not. I'd like to share with you the truth in medicine with no spin, no marketing, just the simple and varnished truth, as well as some trusted sites for information you can reference right from home. I hope you'll find this material beneficial, and I wish you a healthier, happier life. Now, more than ever, it's important to take care of your health and develop a strong immune system. The one source of truth I'd like to share comes from the Harvard Medical School at www.health.harvard.edu. Our immune system is the first line of defense against diseases or infections. If your immune system is strong, you're better equipped to fight infection and disease. The top things you can do to keep your immune system strong is to exercise, maximize the nutritional content of what you eat, meaning it's not merely the calories you eat, but the nutritional content of those calories that's most important. Getting proper rest, reducing stress, and avoiding smoking. So a little bit about exercise and stress reduction. In addition to the cardiovascular benefits of exercise, it also contributes to good mental health and reduces stress. Exercise actually has anti-inflammatory benefits and promotes cellular repair, cell production, and produces immune cells that help you fight off disease. You can still get in the proper amount of exercise right from your home. Many workouts are now online and can even be calisthenics-based. Also, you can grab the leash, walk your dog, go for a bike ride, or a jog. Stress reduction can also be achieved through prayer or meditation. Keeping stress at bay is critical to good health. Stress actually induces cortisol production. Cortisol is called the stress hormone. Let's talk a minute about nutrition. Proper nutrition benefits your overall immune system. I've said this time and time again. Food can act as medicine. Dark leafy green vegetables, citrus fruits, nuts, berries, fish, whole grains, foods rich in antioxidants are critical for your health. Studies have also shown in vitro that vitamins A, C, D, and the minerals zinc and selenium can actually boost your immune system and fight infection through boosting your T cell function and increasing their activation to attack the pathogens. Please, though, always consult your physician before starting a supplement regimen to ensure no cross-reactivity to the medicines you take. Remember, safety first. Let's talk a minute about sleep. Although difficult at times, getting a good amount of sleep is very important to your health. According to the American Sleep Association, sleep may help the body conserve energy and other resources that the immune system needs to mount an attack. In general, I recommend at least 7 hours of good restorative sleep each night. Sleep hygiene is critical to be successful here. There are ways you can get a better night's sleep, such as engaging in relaxing activities before bed to ease stress. As an example, lighting and sound make a difference. Try not to have bright lights, watch TV in bed. Instead, dim the lights, make sure the temperature is cool, and read a book. Avoid caffeine after 1 p.m. in the afternoon. This is a big no-no. People who caffeinate later in the afternoon, you're almost certainly not going to get a good night's sleep. Also, intermittent use of melatonin can also help you fall asleep faster and help you reach the deeper stages of restorative sleep. Smoking elimination, another big one. Smoking, whether it's tobacco product or vaping, creates direct damage to your lung lining. See your physician to get started on the smoking cessation program. It's probably one of the best things you can do for your overall health. If you need a physician, please visit www.chsli.org or call 1-855-CHS-4500. For more health information, tune in to CHS Presents Dr. O Faithfully Transforming Healthcare, airing on the Catholic Faith Network and CBS TV 55. To view recent episodes, go to CHS's YouTube channel, where you can also watch Dr. O's Health Tips and Solutions. If you would like to know more about CHS's primary care services and what they have to offer, or to make a gift in support of this or another program that's important to you, please visit chsli.org. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please email us at dro@chsli.org. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Dr. O Faithfully Transforming Healthcare.